Okay, welcome everybody. Just so you know, we are recording this session, so please stay on mute unless until we're between slides. Between each slide, we'll stop quickly for any questions that people have. And if you are eating and you want to be on off video, that's perfectly fine. You can always come back on when you have a question or when we're ready to start the more interactive portion of the training. Right now, I'm going to screen share and I'm going to make sure that everybody can see and hear, and then we're going to get moving. All right. Okay. So this is what we're going to be going over today. Most, if not all of you, have run focus groups or group meetings before, so a lot of this isn't going to be super new, but this is just how this particular facilitation is going to go. So what we're going to go through today is just the setup process of how you're going to invite people to participate in this focus group, how we're going to ask you to set up your space. There is a video that you'll be able to play that is me talking over slides, and you'll be able to use that so that you don't have to read from a script or do a whole lot of narration. And then you will go into the actual facilitated part of the conversation. So that's the plan for today. And we're actually going to run through that today. We'll do like a whole session exactly as you will do it. So you should be really comfortable with it because you'll have actually gone through the process. Okay.
So as you are inviting folks to participate in your space, please note that the time frame that we need to conduct these facilitations is March through April 2024. So we ask that you invite folks for an hour to stay. Encourage them to participate because their participation is key to the health assessment. When you're coordinating, you would like to coordinate within your own organization or send an invitation or a registration link or something that would help to have the participation happen at your space. In your space, you want to have it be ready, have the materials, the food, everything, the accessibility that your folks that you need may need, any accommodations that they might need, coordinated by you or your organization. And so you want to really help people to participate with confidence, using empathy to encourage their participation. Try to choose a time and a place where participants may already be gathering within, whether it's a support group or a group that you already conduct within your own organization, whatever feels comfortable and encourages the participation. We hope that you could get at least 7, the minimum of 7, but the maximum of 12 participants to participate, have them register, and if there are more people, plan to have more facilitators. We encourage 2 facilitators per group, so one person could facilitate while the other person could note take. Let us know when and where you'll host the focus group. We need to document in the health assessment where all these focus groups take place. If you're not sure who to invite, let us know. If you serve youth, but also families, for example, we could help you out, flush out some of those questions. Each facilitator will be paid $200 per group that are hosted. you all decide how that funding will be dispersed, and you'll have $200 for the group to use as you wish, whether it's to give your participant an incentive, to have food at your facility for the group setting when you set up your group setting, or for the facilities, or for other costs. However, if your participants need like transportation or childcare or interpretations in other languages, there are some additional funds to cover those costs. So I'll pause right there to see if anyone has any questions. Okay. And none in the chat, Chelsea?
I don't see any.
Okay, great, thank you. So we'll move it along.
Oops, sorry.
So in setting up your space, you want to make sure you have your materials ready before the day, at least even an hour prior to your focus group. Make sure you have flip charts or whiteboards with your markers, printed copies of the identity wheel, which Chelsea will get into in further slides, pens and notepads or sticky notes for participants, whether they could write down things that could go in a parking lot or to contribute to the questions being asked in the focus group. Pens and of the video setup, which we'll go through in a minute, and a talking piece. Look for a piece that people could hold while sharing their input with the questions that are being asked, so that way they respect and listen to the individual who is talking, and it could level set how the agreements are come upon. A timekeeper or even a timekeeping device, it would be appropriate, so we respect people's time and we don't go over the hour and everyone has an opportunity to speak. Note-taking tools for yourself, and also have a sign-up sheet for folks who are interested in continuing to be a participant or engage in any other community activities that we have. They could sign up for our newsletter, or we could follow up with them as needed. So I'll pause right there and see if there are any questions. Great.
There is a question in the chat about sharing the slideshow. Oh, yes. Sorry, Chelsea. Forget me. I'm muting myself.
That's okay, Jody. Yes, we are going to send you all of these slides. So this is actually the first slide that you would show to your participants, which will be, just a slide. There's no narration or anything that goes with this one. And you'll have full control over how long it stays up and, just click through it. But this is just your welcome, hey, this is what we're going to do today. You'll go through your, if you've got food for it, you're going to talk about your, where the materials are and where the bathroom is and how long you're going to be there, and just kind of a general welcome. Then you're going to go into your group agreement, and Rosa's going to walk us through that.
So when setting your group agreements, that will support your framing for the discussion. So what you could all do when you make this a productive and enjoyable experience, the talking piece that I talked about is a good way to engage everyone in the conversation and respectfully listening to one person at a time. So it creates that physical awareness of the time each person is talking. Having a timekeeper or a timekeeping device where it allows the time for everyone to kind of speak, but also that it gives enough time for everyone to speak. Having some notepads in case people have some ideas, some thoughts, and didn't have the opportunity to talk, or just time didn't allow, it gives them an opportunity to write things down and still collect their input. So really, remembering what's important about group agreements is to remember that these agreements need to be generated by the participants themselves. So when asking the group for group agreements, really encourage them to use, to agree upon whatever the whole group agrees upon to agree upon. So I'll pause right there and ask if anyone has any questions or would like to add.
So this would be, rather than a slide that you would use, this would be something you would either put up on a note, on a whiteboard, or on like a easel. And as the group is throwing out their thoughts about what the group agreement should be, that's when you're going to write those down on that board, and then leave that so that if you need to refer to it at any point during the focus group, you can kind of point to it as a reminder, like, hey, remember we said that we were gonna do this. Let's make sure that we do, whatever. So that's the group agreement.
Just remember, group agreements are not rules. You know, it really is to help create that safe and caring space and to
So
enhance that activity.
shall we practice? This is a time, so we're going to actually run through this like it's a real focus group. So why don't we throw out some additional group agreements that we would like to share.
You want us to do that right now? Okay. I just wanted to make sure before I just started talking uncontrollably. One of the group agreements that we usually do when we do dialogues is what happens here stays here, or what's said here stays here, but we hope that you know, what you learn here leaves here. So that's always a good one.
That's a really good one. For a focus group, and especially something that's going to be documented, I think it's really important to say that, but also to frame it in like, you know, so the general gist of what you're saying is going to be recorded, but the details, like the, you know, the who and the, like, we can leave all of those, the details that would be
personally identified.
Yeah, exactly.
Yep.
Anybody else have ones that they want to throw out there that they like?
So in the chat, Tara puts non-judgmental and having a safe space.
That's a great one. And of course, as the facilitator, you can always like elaborate on that, or if you have a particular thing that you call that or way that you like to frame it, you can always write it down that way or say it that way. Anybody else have others? And I'm sorry if you can hear my dog barking. Somebody's walking their dogs by my house.
I have a question, which is, are we showing this slide and then like we're going to write our own thing and build off of it? No. Okay. I think I saw Chelsea's head shaking. Okay.
Yeah, no,
So-
instead of the slide, you would write, group agreement up on a board or
Mhm.
on whatever your flip chart is, and write them down as people are. You could kind of pre-populate it with a few like these,
That's
like,
what I was thinking.
we're going to
These
use
are
a topic
great.
piece. Yeah,
Right. Yeah. So I would like to have those. Okay, great. Thank you.
yeah. Good question. Should we keep going? Does anybody have any more? All right, we're going to keep going.
And Jenna, back to your question, when you're setting your space, that's why some of those materials it's important to have in those spaces. So that way you utilize those materials for the activities and the prompts that you will guide your group with.
Thank you. So the next thing you're going to do after you've done your group agreements is this identity wheel activity. You're going to have these pre-printed, just the wheel, and give them to everyone. You're going to instruct them not to put their name on the paper because you'll be collecting them, and that they can write as much or as little as they want to on that wheel. They can use emojis for things that they're particularly proud of. It would be nice if they could maybe circle anything that they feel are kind of central to who they are. And I have one that I've done, so you can go through it with them and demonstrate it as the facilitator, so that if they're confused about like how to fill this out or what to do with it. But what it does is kind of instead of having like check boxes for demographics of like, how do you identify? It's just kind of a friendlier and more thoughtful way of getting that information, and it allows people to really have control of how they want to present that information. So I'm going to show you mine, and then we can talk about that. Okay, so if I were to fill this out, this is what mine would look like. My language is I only speak English, and I have a little frowny face there because that kind of makes me sad. I have a college degree, and I circled that as something that I'm proud of and something that I feel kind of is part of like the central part of my identity. I also circled my identity as a woman, and as a mom, and my relationships with my work people and my theater family, and those are how I identify my relationships. People might not put a lot of information in certain areas, and that's okay. We don't need people to necessarily identify the age bracket that fits with a certain demographic. If somebody wants to put their exact age, that's great. If they just want to put none of your business, that's fine too. They might not put anything under certain areas. Like I didn't put anything under ability. I chose not to say anything about religion, values, or beliefs. That's okay. People could say a lot more about certain, areas. They could like class and income. Maybe you have more than one that you identify with. So there's multiple ways to fill it out. No way's really wrong. And they'll give us kind of a better idea of like who's in the room and where they come from, and perspective wise. And it also kind of gives them a little time to kind of be introspective about like, where do I sit, and what matters to me, and how is that going to be reflected in how I approach this conversation. Does anybody have questions about the identity wheel? And we're not going to give them like a huge amount of time to do this, like 5 minutes or so, because you want to be able to kind of move right into the conversation as quickly as possible.
Chelsea, can you share an example of what someone might say for ability? Are we looking for like physical or otherwise or purposefully open-ended?
So that's why, yeah, it is purposefully open-ended. That's a really good question. So, you know, somebody might say, I have ADHD or I have PTSD, or they might not want to say anything about that, or they might have a physical disability, or an invisible disability that they want to disclose. And that's, so it is purposely open-ended. And I know when people collect demographic information, they don't love this, but I like it.
And it's really not about demographic. It's also about just their identity. You know, how do you identify yourself, which is never asked? It's really, to Chelsea's point earlier, that it's not a checkbox. It doesn't constrict you to one specific identity. It's who you are and how you want the world to see you.
Anybody else have questions about this? All right. If you think of any, we can come back, but we're going to move on.
Welcome, and thank you for giving an
Pause.
every
Oh,
3
hold on.
years public.
Okay. So this is the video. I am going to give it to you separately. So this will be its own separate thing that you get, and you will play this from, as soon as you start playing it, it will narrate from the very beginning with my lovely voice. And apparently there's more dogs. I'm gonna play it.
Welcome, and thank you for giving an hour of your time today to contribute your experience and ideas to the 2024 Community
Sorry, I'm trying to mute. There we go.
Health Assessment for Health Alliance Clinton Hospital and Haywood Healthcare. Every 3 years, public hospitals in Massachusetts are required to conduct a community health assessment. They collect data from a variety of sources to get a better understanding of the challenges that can lead to poor health outcomes for people in their region. One of the ways they collect this data is through focus groups like this one, where residents can speak about their experiences accessing local health care and other services and share ideas about how to better address unmet needs. This assessment covers both the Haywood Healthcare Service Area and the Health Alliance Clinton Hospital Service Area, shown here in green and outlined in bold. The data is reported for both the entire region and for each hospital's separate service area. The blue shaded area indicates the overlap between the service areas. A health assessment collects data from the census and state systems like schools, courts, and the Department of Labor and Workforce to understand general information about the region's population, things like average income, how many people have graduated from high school or obtained a degree, what languages are commonly spoken at home, and demographic data like race and ethnicity. Hospital data is used to understand what diseases and health conditions may be common in the region. From this secondary data, we can make assumptions about the needs of people in our region. But to really understand the root of those needs and what solutions might be, we need more detailed information. That's why community surveys, interviews with key stakeholders, and focus groups like this one are so important. You may have taken a survey about maternal health care, transportation, or food access recently. Those surveys and others all provide important data for the community health assessment. By speaking directly to community members in interviews and focus groups like this, we get even more detailed information about the issues that affect people's health and well-being every day, as well as ideas about how to solve these issues. What happens to these community health assessments when they're done? The assessment is used by the hospitals to guide how they spend community benefit and grant-making dollars. They direct spending toward community programs and interventions where they can have the greatest impact on urgent needs. The assessment also helps hospitals and other community organizations make the case for grant funding and policies to address priority health issues. The health assessment report is available to the public and can help raise community awareness of issues and provide data to back up advocacy efforts. Because the assessment is conducted every 3 years, it is a useful way to track trends over time. The assessment is also the foundation of a Community Health Improvement Plan, or CHIP. Each hospital has their own CHIP, and so do several other organizations. The Health Equity Partnership of North Central Mass holds a CHIP for the whole region, which many local organizations, as well as the hospitals, work together on. These CHIPs aren't created brand new every 3 years. They're continuously improved through a cycle of designing, implementing, and evaluating solutions before assessing the community again. A few examples of initiatives that have come about because of previous health assessments are Local Food Works, a collaborative dedicated to building an equitable food-centered economy. The Anchor Collaborative, a group of large local institutions aligning their spending to build community wealth. And the HEAL Collaborative, which brings residents and institutions together to empower a just, engaged, and prosperous community. Issues that come up in community health assessments can be complex and interconnected. Solving them takes time, and it takes many people and organizations working together. Some of you may have participated in an analysis where you were asked to think about what we call key dominoes, the drivers of healthy and prosperous communities that have a positive impact in other priority areas. This analysis told us that if we focus on building strong connections and collaborations among partners, promote policies and funding that support public health and social services, work toward dismantling racism in our systems, and have affordable, reliable, and convenient transportation for all, this will support better outcomes in our learning and working environments, and ultimately will help people have better access to mental and behavioral health supports, safe and affordable housing, and affordable and culturally appropriate healthy food. Over the next hour, your facilitators will lead a conversation about the issues that matter most to you and invite you to share your ideas, wishes, and advice about what changes could be made here in our own communities that would improve people's health and overall well-being. There are no right or wrong answers. We encourage you to think boldly about the future you want for our region and speak from your heart. Thank you for helping design a healthier North Central Mass.
Okay. Sorry, it was also flashing messages that was very quiet. So was it too quiet?
I can hear it just fine.
No, it was fine.
Yeah, I think it was just saying it was too quiet for the subtitles, I think, to pick up. But yeah, I could hear it just fine.
Okay. All right. Then I won't re-record it. I will just send them to you. So you will play that. It is going to stop between slides. You can set it up so that it will go continuously if you want to, or you can set it up so that you have to advance it slide by slide. That'll be completely up to you. So then you'll kind of just, this will be you talking at this point about, so there are issues that we see, that we know about, that pop up over and over again in our region. And some of them come up every health assessment, right? And others feel like they're newer or more urgent, or that they've changed somehow. And so we as facilitators kind of want to come into the space acknowledging that we already know that there are a lot of things that are on people's minds, And here are some of the ones that we know about, that we have heard about. And they may be slightly different for you, but for us at the Chana, we have heard a lot from people about the immigrant and migrant situation, people coming into our communities who need housing and jobs and services, and may have language barriers, and our systems that really have not been prepared to respond. And the housing crisis. We all know that there's not enough housing, that housing is too expensive, that it's hard to stay in housing. Rents are going up. There's increasing homelessness in our communities. We have a healthcare crisis. This is a national thing. But very specifically in our region, we have not enough providers. We have services that are closing or moving farther away. We have an ongoing mental health and trauma crisis that is, again, not specific to our region, but has been on the rise. Substance use, interpersonal violence, self-harm, and again, exacerbated by a lack of providers. There is a climate crisis. There are weather-related threats, and you can make this as specific to your community as it seems appropriate to you. So if I was conducting this in Leominster, I would be talking about the flooding that happened over this summer, and the health and safety concerns that are rising from the ongoing climate crisis. And Shayna got kicked out and is being let back into the waiting room. Okay, here we go. All right. So for that kind of leads you into the first question. So there's only two questions. So this is where you framed everything up and you will ask your group, does this resonate with you? Is there something else that you're thinking of? So really the question is, what do you think of as the biggest story or the defining issue of our time in our region? In 45 minutes, you're not going to have time to go like really deep into every single one of these issues. So you're really going to just ask people like, what is most important to them right now? What do they feel like they really want to talk about in this moment? So let's do that with the group. So what would this group want to really talk about? And it's okay to pick more than one thing, and or for people to have different things that they want to that are most important to them.
I think for our little corner of the universe, it is, for me anyways, the healthcare access, and the kind of shifting environment and changing tides with regard to that.
Sure. So for anybody in this group who doesn't know, Jenna is from the Neshoba Associated Boards of Health, and their hospital system is Steward. That is their closest hospital. They are part of the Health Alliance Clinton catchment area, but the things that are happening with Steward right now are definitely top of mind with what's going on with them. Jessica says economic hardships. Do you want to talk a little bit about that?
I am from the Gardner area, and I also work for Gardner Emergency Housing Mission, and I can tell you that we have been seeing an increase on people losing their apartments or losing their home, not being able to afford a place to live, or sometimes not even being able to afford food for the most part. And these are people that have jobs that are just not getting paid enough to survive. And unfortunately, that's something that's coming up a lot in my area.
Yeah. Tamara also put in the chat resources to support aging in place. So an aging population is also a top of mind issue. The housing crisis, mental health crisis, transportation. So as people are kind of popping these things up, you could be writing them on the whiteboard or the flip chart, all of the above. And then what you're gonna do next is we're gonna go to the second question. And the second question is where we really want people to spend the most time kind of digging in. And so we're going to say, when you think about these issues that you've just named, what would it look like for them to be going well? So instead of detailing all the things that are going wrong in these systems, we want to flip that to a vision of what would this look like if it was going well, and what would be happening differently to have a better outcome. Maybe you just want to focus on a particular step along the way, one thing that would be moving it in the right direction or that would make a big difference to someone. Okay, so we're practicing. So somebody can start, and you're going to have to probably prompt people along.
I would say maybe we could collaborate a little bit more with our local senior centers, as an example, to help with the transportation issues or lack of transportation in our area. If the header for this particular one was under transportation, and see how we can leverage other resources that are already providing transportation to absorb a little bit more to fill in the gaps. In the absence of getting a train or a bus to come here.
Sure, working with partners like the senior centers. What else would people like I'm thinking about, so Jenna, let's go back, I'm gonna pick on you. So in the healthcare system, what would make a difference, or what would be, if it was going well?
In a pie in the sky world, a nonprofit company comes in and takes over all of the Stewart hospitals. I don't know.
Yeah, sure.
Yeah, everyone has access to a primary care physician within their area. Because that's another issue is, we have a hospital right in our town and we don't have access to that.
Okay, so that's good, Jody, because that gets a little bit more specific. So that's access to primary care, and having more primary care physicians. Is it having more primary care physicians? Is it a matter of primary care physicians available, but they don't take your insurance? What's the barrier there that would help more?
I think most of the primary care providers moved out of the Clinton Hospital and now are providing their programs either in their private practice or at the Worcester campus of UMass.
Okay.
And it's probably because they have better equipment and more access to other resources there, which makes sense too. But it doesn't help anyone in Clinton and at our hospital.
So people who practice in the system actually having office hours or availability in the town.
Yeah.
And then, and I think the other thing you said was people actually like moving.
Accepting mass health is another.
So whether they're moving into private practice and not accepting mass health. Yeah, okay. Jessica, oh, go ahead, Rosa.
I was just gonna, I just heard Jody in her comment. I also heard capital cost. Are providers moving out of the area due to equipment and resources versus what's locally available? So capturing those type of notes is critical, you know, that we capture everything and anything that people are saying.
Rosa just demonstrated why it's great to have two facilitators, because you are going to hear different things, and why it's good as a facilitator to kind of say back to the person like what you are hearing them say, so that as you're doing, and the person who's doing the note taking doesn't have to like sit there silently. They can do that part. So they can do the part where they say back, like, I'm hearing you say this. Can you say more about that? Or you can say, I'm hearing you say this, and let them say, well, yeah, but also this, so that you're really getting a deeper understanding of what it is they're saying. Jessica, you said economic hardships, and you talked about like people not having jobs, but not jobs that are paying enough to get to really even get by. Do you want to talk a little bit about like what that would look like if things were going well? What you think would be improved?
I think that, I mean, other than the obvious, if people were able to maintain jobs that paid enough to live in this state, that would help a lot. Not a lot of people are living paycheck to paycheck, or with one paycheck behind, they fall behind quite a bit. We're seeing that a lot. I think one of my biggest things I think is rent control. It's insane how much the landlords can up the rent, and there's almost no limit to what they can do. It's very unfair, and it's not right. There should be something to help that situation. Also, I think I also help people with SNAP applications, and unfortunately, some people don't qualify just by dollars, and the amount is so it should be lower. It should be lower for what people can get to qualify, in my opinion, because it's outrageous. It's just outrageous what people are paying. It's more than what some people's mortgages are. It's insane. I would love to hear other people's feedback on how this could be improved, because I just don't have the answer for it myself.
I think rent control and a higher threshold for what we call, the poverty line, or what the, what the eligibility for SNAP is, are great things to say. And I think as a facilitator, don't discourage people from saying things that, they don't have an immediate solution for, or that they don't feel like you can change right now. The hospitals can't change who qualifies for SNAP, but it's still worth, noting that these are the barriers, and these are some of the things that would help, because some of what helps is advocacy.
And again, these focus groups it's another way to collect data, another way to collect data, and it's going to be documented. So it's important that no answer is no wrong answer. This is what's going to help move the community, make the movements. So really back to Chelsea's point, really encouraging participation is key, and really key to the success of finding those solutions.
I'm looking in the chat. Tamara, I see when you were talking about seniors and how to support seniors better, having ways for them to remain safely in their homes instead of having to move into senior living facilities, and give them the support in their home for activities of daily living and social connection. Do you want to talk a little bit more about that? Or was that everything
Sure.
you wanted? Go ahead.
No, I think in terms of like trying to be solution focused, I think incentivizing and recruiting a workforce, because that's the biggest gap, is that there aren't the people to do those things. And there are some programs that allow family members to be paid caregivers, but it's not enough, and it's a lot of hoops to go through. So I think supporting our family members that are trying to fit this role, that are sandwiched between maybe raising their own children and also having seniors to care for while trying to work. So I think, somehow having some resource to, allow those people to do that and still maintain their own livelihoods and make a living, and also trying to think of ways, like I said, to recruit and incentivize this workforce, because it's a serious gap. We don't have enough healthcare providers, whether it's doctors, nurse practitioners, nurses, home care aides, personal care, therapists, any of it really, mental health or otherwise. And so we're finding a kind of a mass exodus of people, wanting, at least in nursing, I'm a nurse, so I'll speak from nursing, to, that bedside care. And why is that? And how do we address that? I think, we have to be mindful of, good compensation and having enough people to share the burden of work, so that the people that are working really hard and have the skills and experience aren't burnt out. And so I think there has to be, some sort of incentivized programming. And then also I hear from nursing students and people that are undergoing training that a lot of burden is on the student to find their clinicals and their rotations and their internships. And that's counterproductive to what we're trying to accomplish for the end goal, which is to get a more robust workforce to take care of some of the issues. So I think something needs to be looked at in terms of curriculums, that, if someone's paying money, hard-earned money, and they're taking their precious resource of time to invest in a program for something that we all say that we need, then we should somehow make that easier.
So Tamara, you just said so much that if I was just note taking, no, and I don't mean that you talked a long time, like you said, it was dense, like what you said a lot in a short amount of time. And if I was just note taking, I probably would have been having heart palpitations right then, because I would have been trying to like scribble down as fast as I could everything that you were saying that was salient and important. So I am really glad that this is being recorded. And so that's just like a tip for as you're facilitating. If you have a recording device, it doesn't negate the need for a note taker. It's, way better to have some good notes that you can refer to than have to go back through an hour's worth of dialogue. But it is also a really good idea to have some sort of recorded version of what you just discussed. Amparo, you were just talking, you said in the chat some things about transportation. Do you want to elaborate?
I'm just thinking about maybe bringing different problems together, trying to, find different solutions for things. So I know that sometimes it's challenging for folks to get transportation, especially in rural communities. And I know that sometimes an option is Uber and Lyft. However, sometimes there's not enough people employed in this region, right? So if more folks would be able to partake in that, they might be able to get additional income, maybe full-time income or a part-time income. And it would also serve the community because there will be more accessible options for people to get transportation, at all hours when they need it.
Love it. Anybody else? And anybody can comment on like other people's ideas as well, or add to other people's ideas. You don't have to stick with the one. So anytime something is bringing something else up for you, feel free to jump in and add some things. So I'm going to give everybody that opportunity now. If there's other things that are coming up that you want to talk about and discuss, like in the ideal world, what would you change to make things be working better? Shayna, you mentioned the mental health crisis. Do you have any thoughts or ideas that you want to share about that?
Yes, I'm sorry, I was eating. I
Sorry.
think, no, it's okay. I think with the mental health crisis, is just more resources are needed. I think in our area, I think we are doing a good job with bringing more resources in and more, support is being opened up. But I think we just still don't have enough, and there's waiting lists. And when it comes to mental health, it's waiting list ain't the best option. So I think it just more support is needed, and I think in time it's going to come with that, but just continue to bring in more support and then opening up and allowing people to know virtual options are open and those resources are there too. So more resources from people supplying more of those virtual opportunities too.
Do you want to talk a little bit about like the virtual? Is that like a good solution that we should be making more available? Are there ways to make that option better for people?
I think sometimes it's helpful. The population I mainly work with is youth. So transportation is again sometimes a barrier as well. So I know a lot of them do partake in like virtual. It just opens up more resources for them too. And then it also opens up if they're looking for a particular type of support therapists that demographically might not be in this area or more diverse, it gives them that option too with virtual. So just allowing people to know that's an option too. If there's on a waiting list, that's more in person and locally.
Tamara put in the chat, encourage more peer support groups and models to supplement mental health care. Tamara, anybody have examples of peer support or things that support mental health? Those like bridge services, I think is what we tend to call them.
I can talk about even internally here, where we have a grief counselor who is providing grief support groups throughout our region. And, it's kind of a piloted program, and, it's been great. It's obviously filling a gap for people. We all know the downside of unresolved grief and a lot of, depression or isolation or even substance use disorders. And so, it's our way to, try to supplement as people might be on waiting lists to get in to see a therapist or a counselor. It addresses, it allows a safe space for people to talk in a platform with someone who's trained in providing some options for coping and how to manage grief and some resources. So I think maybe a more like let's train more trainers, like I love the mental health first aid model as well, where people are trained in that, and it can be anybody who sits in those certification classes. And I think the more people that are doing this work, the more it can branch out and reach more populations of all people. So I think that's what I mean by kind of trying to do that model. And the peer support, groups like NAMI, and you have lots of recovery coaches and things like that are, those people also have a passion for the work, but it's relatable. And I think sometimes it's some of the best therapy that's available out there, not even just, supplemental. But I think that the more people that are doing that work, it goes back to, creating the resource that doesn't exist. How do we do that? Because we all know there's a lack of resource, and, it takes time for people to get trained and go through school. And, but I think lived experience is definitely worthwhile, and that can have a great impact if we can, as coordinators and collaborators and partners, try to facilitate some of that perhaps, happening. And I think that might be a way that we could help fill the gap.
Thank you. Yeah, that's you said a lot again. So I'm going to, because we are doing this for real, we are actually going to use what we talk about here today as part of the data. I want to also be a good role model, and call on some of the people who have not had a chance to contribute or speak yet, and just get your thoughts. So if you've been kind of quiet so far, do you want to jump in at this point and give us a couple of your thoughts? What's brewing for you?
Yeah, I would just say I'm just kind of listening because I think I'm really in my veterans bubble over here. But I would also say that none of this is a surprise. I think we're all going to hear these things come up from our community members as well, perhaps phrased a little differently given their backgrounds and where they're coming from. So as I'm listening, I think my goal in running these groups will be to help develop their thoughts to the level of articulation that would be useful here.
And Stephanie, you put out a great point. Active listening really helps facilitate a smooth and engaging conversation. So really paying attention to what the other people are saying, showing genuine interest, and just even asking follow-up questions will demonstrate that you're even engaged. So great point. Thank you for sharing.
And does anybody else want to jump in? I know Tara, Shayna haven't really had a chance to say anything yet.
So I think I agree with everything everybody has been saying. So for those who don't know me, I'm the Director of Domestic Violence Services. So these are issues that the people that we work with express to us all the time. So as I'm hearing everyone speak, I'm like, yep. Housing is one of the biggest struggles that we typically hear from survivors, having to make that choice of, do I remain in an abusive relationship to keep a roof over my head, or do I exit and hopefully find somewhere, or have to live on the streets? And finding a shelter is impossible. There's none available. There's never beds available. So I think in a perfect world, there would be more options for shelter placement. We definitely have a need throughout the state of Massachusetts for more domestic violence shelters. But more importantly than that, I would prefer just safe housing for individuals. Having that opportunity to be able to exit knowing you're not gonna hit rock bottom because you don't have a roof over your head, or you don't have a place to bring your children to. So housing is one that we always hear here at the YWCA.
So you're saying rather than having more shelters, not that there don't need to be more shelters, there do, but that in addition to more shelters, that for people to be able to exit directly into permanent housing.
Yes, sustainability, right? That's our end
Yeah.
goal. Like, great, we can place you in a shelter, but realistically, you go into a shelter and the shelter stays right now are around 2 years, where in the beginning of DV shelters, it was you were going there for 6 months and then you get into your stable housing. But this is why there is no shelter beds, because people are staying 2 years because they can't get affordable, safe housing. So I feel like we need to change our lens around this temporary fix, these Band-Aids, and how do we create sustainability for all?
Mm-hmm. Olin, Kayla, anything coming up for you as you're thinking about how you would do this with youth?
I think, sorry, I'm eating.
It's
I think
okay.
one thing that came up for me, at least thinking about doing it with youth, is like what guiding questions can we be asking to try and, because I feel like these are big pictures, particularly for youth to think about. So I've been trying to think about like how we can break them down and ask some more like follow-up questions to try and get to the meat of the issue.
Yeah, I agree with Olin, trying to work on meeting youth where they're at and letting them guide the conversation more. Also, potentially seeing if they'd be able to share their own resources and what they know in the community. I think it would be a big ask, but seeing if they can take this conversation home and talk to their parents and get ideas from them. That's something Olin and I have been talking about. Just kind of looking at what that's going to look like for youth.
That's an interesting idea. Yeah, I mean, go ahead.
I was just gonna say my only concern with asking your parents is adultism. You know, the parents will take the role of, I know what you may, you know, I just feel like then the youth won't, their voice will get lost, and not what they feel is a solution to the issues that they face themselves. Sometimes they don't talk to parents about this stuff that young people are, you know, facing with their peers or at school. They leave some details out when talking to parents. So and my fear is we don't get the this is an opportunity for young people to really talk to us about what they're facing and what resources they need to better their outcome.
I was going to say, I think too, it's important for us to say that like we're asking a very, very wide group of people who do like service for multiple populations, because those conversations are going to look different. A conversation with youth is going to look very different from a conversation with veterans or a conversation with people at a senior center. They are going to be very different conversations because different things matter to them. So I think like that's why we ask that first question about like what matters to you. What are the big things that you want to talk about? So we're guiding this conversation based on the things that you all mentioned. And you are all service providers who have like this very big, wide lens as far as like what is needed. And you have this like very broad picture. And some of your community members don't have a very broad picture. They're going to say something really specific to their neighborhood or their community in general, you know, their peer group, and that's okay, because you can kind of extract from that some more general things. Like I'll give a quick example is when we did our charrette series over the summer, we had a lot of people who brought up the fact that they had lost their town newsletter or their town newspaper, and that they were not, they felt disconnected, or they felt like their access to what was local had really changed. And some of them said, like, I don't do social media, or I don't have regular internet access. And so, that may have been like they were talking about it in a way that was very specific to them and their town, but they were speaking to issues that a lot of people might have. A lot of people might not have regular access to the internet, or may not, in the age of social media, may really feel like their access to what's going on in the world has been changed in some way, or diminished in some way, because that's not how they like to get their information. And so, like, it's kind of up to you as the facilitator to let them have those conversations in the more narrow, specific ways that mean something to them, and for you to kind of extract from that some more broad kinds of information. Does that make sense?
So how, or maybe we're getting to it, how do you want this information packaged and returned to you, right? So to condense 45 minutes of conversation back to you, what does that look like?
Yeah, we are getting to that.
I'm like, yikes.
Yeah. So, depends on how you take that information. So, if you use a recorder, like an Otter or something like that, and you want to go, what we are going to ask is that you don't give us like a 1 hour long audio file, because if we get 20 of those, we'll go insane. And we won't really have we still won't really have a good idea of what happened, honestly, like, even if we just are able to listen to each one of those. What would be more helpful is for you to kind of distill from that. These are the notes, these are, and if you are able to kind of categorize them, like, these are, topic area, like, this is when people were talking about this is what a lot of people said. If you're able to pull out any quotes, or if you're able to point to a time within a recording that, somebody said something that you're like, this person was really well spoken about this, you might want to listen to this piece. You could just point us to like specific timestamps, and we can use it that way. Rosa, do you have additional comments on how we would like to get that information?
I was just thinking themes. Also, like, if you heard the same theme coming up again, instead of, you could just collect the data, like, in the group, several and people identified with this type of theme. It's the only thing that comes to mind.
Mm-hmm. And just noting, whether something was coming up as a barrier, like this is something that needs to change, or if something was coming up as something that we need more of, or something that, works really well. So like a snippet that you note about like bridge services, like, you can't just, if you write bridge services, we're not going to know what that means. Like, does that mean, that they're a really great service and that we need more of them and we need to support them through policy and through more funding, or that they need to be more sustainable, or they need to accept different insurances, or whatever the or that the people who are running them need to be paid more. So like, what are you have to be specific enough for us to be able to get the usable information. but you can, obviously leave out a lot of the example detail. There's condensing it into like the most important themes and recommendations. Anybody else have questions? I'm gonna move to the next part about like how to do the facilitation, unless anybody else has things that they want to talk about here, because we're kind of moving into the next area now. All right, I'm gonna go to the next slide. So here, we're just gonna go over a few tips. So you'll notice that we were really trying to frame these in a way where we say like, what would make this a good experience? How could this have gone differently? What, being really solution focused, like what would make these systems better? Because what we don't really want is to kind of just circle around and around the problems, because they're going to come up in the conversation. As you say, we need more of this. Well, by default, we know that means there's not enough, right? You can say like there's really long wait lists for this. If we had more of this, then that would help that. Sometimes people are really going to be itching to like tell you their story, which is like, starts with like how they were or weren't greeted, and how long they sat on the phone, and what the person said, and who spoke or didn't speak their language, and their tone of voice. And like some people are going to want to tell you the entire details of a story. So, for the sake of time, especially if you have up to 12 people that you're trying to hear from, you want to make sure that you're gently getting to the important parts of that story. And if that what that can sound like is summarizing what they're trying to say. So you can kind of say things like, it sounds like what you're saying is, if people spoke with more respect, that you would have had a better experience. Are there other things that would have made this experience better, other than people being more respectful when they talked to you? You said that you waited on the phone for a long time. Maybe there's some staffing issues that would more staffing or more training in these, you can kind of guide that into like that solution oriented, what's going to help. And here's something that I always need to remember as a facilitator, is to try not to add your own experience or to editorialize too much. So yes, reframe what they're saying so that you can get to like the meat, the nut of what they're saying, but don't kind of come back at that as like, oh my gosh, I remember when that happened to me, and yes, I sat there for hours, and I eventually hung up, and I was so frustrated, and like now you're taking up their time to talk. Anybody have any questions on this particular slide? These are just some suggestions, and again, this isn't something you're going to put up in your these are just for you, and you will get these.
And again, you could encourage them to sign up for the newsletter if there are other resources and other, guiding tools that they need to find solutions to their individual issues or concerns that they have, or offer 5 minutes after the facilitation where they could get a contact or a resource that they might need for more follow-up with the issues that they are facing. They probably come in.
Oh dear, was that me?
Solution today for these issues, and that's really not what the focus group focuses on. And so just even providing some of those tools and resources when they come in, we didn't listed it as they're in the materials, but even your all service providers, even if just offering some of those tools.
Rosa, you were already starting. Did you want to take the rest of this slide?
Awesome. So really knowing your materials in advance is helpful because if people come up with some of those questions, you're able to elaborate. You are the trusted member of this community or group. People see you in these institutions and they come to you because you're the one they open up to. So remembering the questions in the conversation that you're answering them. Having a timekeeper just lets it help run smoother. Really remember as a facilitator that you are giving participants the space to share. So making it a safe space, a brave space, but keeping the focus on them. You all mentioned earlier about active listening and really pause and reflect, asking clarifying questions. Check in with visually. Does anyone out there look like they're thinking something or want to say something or might disagree? You know, so you want to kind of scan over your audience and see if there's some, you know, some tension or somebody wants to say something, that the opportunity is given to them. But again, shy away from long storytelling. Let's just dig right into the point. Allow people to validate without restating, give everyone a chance to speak. Once someone has spoken, make sure that others had the opportunity before they speak again, and really encourage people to write down their thoughts when it isn't their turn. And you know, have a parking lot, have some sticky paper where they could just, if they have some other thoughts, please put them on those parking lot areas. So I'm going to just pause here and ask the group, are there any questions about tips for facilitating this conversation?
Are these groups meant to be strictly in person? Are there any availability or access via, you know, Zoom or virtually or hybrid models at all?
You could choose, that's a good question. You could choose to run it via Zoom or hybrid. We'll give you, you know, the materials, and then you'll kind of have to figure out like how to make that work for you. So it partly depends on how comfortable you are with, you know, running the slides and getting people to be interactive via a Zoom. It's definitely a little more challenging to get people engaged in conversation. So I think like we'd prefer them to be in person, but you're gonna know your group best. So we're not gonna tell you no.
Thanks. Yeah, I think person is in best too. I was just thinking about widening the net a little bit maybe. But yeah, I don't know if I have that skill set, so to balance that.
Yeah, and part of those tips of facilitation, like when you're not, you know, you're checking in visually, it's kind of hard to read body language and invalidating people's feelings when we're in technology. So really I encourage I'm with Chelsea encouraging the in-person Tamara, just to get a better sense when you're facilitating the group.
And I'll just say that these tips are like the very, very general kind of facilitating tips. And as you put together a group, chances are good that you're going to know the people who are in that group as they're registering. And so you can be thinking kind of ahead of like, oh, this person's always really quiet. Like, how am I going to get them to like open up and participate? Or like, everybody knows that there are some people who will come into a group and will dominate that group, right? And that will, you know, given the opportunity, will take up the entire 45 minutes. So how are you going to manage that? And make sure. So it's, you know, how you set up that space and how you're going to like present, you know, your group agreement and timekeeping and those kinds of things kind of all depend on, you know, what you know your group is going to be like. Just checking the chat to see if there was anything else. Anybody else have questions on this?
And really
General
effective
questions.
Yeah. No, I was just going to say really effective facilitation really is a discussion that involves the recognition, you know, of the different perspectives and the different skills to create that inclusiveness. So it's about, you know, just level setting field.
Does anybody have questions about like what, who they should be pulling for their groups, or just general questions about how this is going to go or what comes next? Because the next thing that we're going to do is like send you these slides and the video and basically say like, let us know what you've set up. So if you have any questions, now's a perfect time to ask because somebody else probably has that question too.
Chelsea, oh, sorry. Chelsea, I sent you an email. I'm wondering if this is something that we could facilitate at the North Central CCRN meeting, or if that wouldn't be an appropriate space.
Yeah, no, that would be fine.
Okay.
Absolutely.
I'll plan that for April if you want to co-facilitate that with me.
Yeah, we can do that for at the April one.
Yeah.
Sure. And that's just, do you have, do people usually register for that or do they just kind of pop in?
They kind of pop in, but I'm going to let them know what we're doing. And then of course we'll do that one in person. So I'll give them a heads up that that's what we're going to focus on at that meeting.
Okay. And it's usually not more than about a dozen people, right?
Correct. Yep.
Okay. Again, like it's not a problem to have a bigger group, but if somebody's going to have a group that's bigger, really like as soon as you hit like 14, I would prefer you have two groups that you can break that into and two facilitation teams. Because as you can see, like right now, like we've been at this, you know, for an hour and a half. And if you're going to get it done in an hour or less, you're really going to want to make sure that you have a small enough group to let them all have that talking time. I strongly dislike being in a focus group where they're trying to get through too many questions. And if somebody talks for more than like 30 seconds, they're like, okay, anybody else have anything they want to say?
So question for our purposes, only group that's approached us for our facilitation with the email that I sent out is Berlin, which watching your video, I learned that they are not actually in the catchment area for the community health assessment, although they are within 9's catchment area. Is that still okay?
Yes.
All right, I figured as much. In presenting the video, I would imagine probably people will have some questions about that. So I'd love to chat with you guys. It doesn't have to be here, but maybe offline about just like the best way to address those questions. And like, yes, your thoughts do matter here, right? Just because you're not, you know what I mean? I think it'll come up. And then the other question would be, so that we'd be, Berlin would be recruiting the participants for us. We're just going to show up with all our materials and stuff and ready to facilitate. Would it be possible to share the video you recorded with the person at the community center who was asking all the questions? Okay, great. Perfect. Because I think it answers all of them quite nicely, packaged up beautifully. So I think it'd be a great thing to do. All right. So is that available like separate from, you said you were going to send us like a link or something to the video, right?
Yes. So I'm going to send you a few things. I'm going to send you a link to the full recording of this training. I'm going to send you the slides that are not part of the video, that don't have like my narration. And then I will send you separately the video portion.
Okay. Awesome. Sounds good.
Anybody? Oh, and I'll send you the a printable identity wheel. Anybody else have any questions, thoughts? Not that you can't email us, but we're here now, so. All right. If you do think of anything, let us know. If there's any other ways that we can support you, let us know. Rosa Rivera, while I've got you, while you're here and listening, I wanted to know if you had any anything you wanted to say in response to Jenna's question about people who, when they look at that map, are like, I'm actually from outside that area. Does what I say matter here?
I think yes, because we want to hear from the communities, right? And if it's just outside of the scope of the region that we're touching, it's still, I think it's still relevant. I think, yeah, we want to hear from the community and we don't want to discourage them from participating.
One thing that came to mind as I'm hearing Rosa speak is that when you're meeting with your groups, because the assessments are for the health care institutions, that the groups don't feel like they have to talk about health issues, but to socialize about any issue, because they probably align with social determinants of health. And so you know, so sometimes people will sit in these focus group and you'll share that this will be a health needs assessment for the hospital institution. Automatically their minds go into, let me talk about disease, let me talk about health outcomes, and not really looking at the underlying issues that that give you what your health outcome is, you know. So to really like
tied to our health, right? So that's a very great point, Rosa, and you definitely want to make sure that no one deters away from talking about other issues, because it all ties back. Everything that we do ties back to our health in one way or another. That's a great point. I like that.
Yeah. I'll add to Jenna that that made me think that while we are collecting data for the health assessment and for the hospitals, just because you're not part of the hospital catchment area, you are part of the Chenal catchment area. And that data is used for so many more things than just the hospital's, you know, interventions, right? Like
community health improvement plan kind of sits with you guys. So that also applies to Berlin, et cetera. Yep, that's a very good point. Yep.
Right. And the host organization probably can use some of this information too. Like you're getting information from your own clients and participants and community members. And, you know, so how can you as, you know, as a leader in your community respond to the things you're hearing? So I think if people have questions about it, you know, maybe the issue that they're raising is not something that is hospital driven, or that the hospital is going to have a health intervention response to. but it's still information that's worth sharing because there are other organizations and coalitions and advocacy that will be happening in your community. So there's no information that's like bad to share.
No, and we're really looking at solution-driven process. So maybe your community has a solution to what they're doing within their own communities that others may not, and maybe we could follow suit or follow the model. So anything's possible.
I think someone asked earlier, way earlier in the chat, if this was in Spanish. Jody, I think it was you. It will be. Rosa is recording a Spanish version of that video. So we will, if anybody intends to facilitate a group that is in Spanish, let us know and we will send you that version. I'm going to send everybody the English version right after this, but then Rosa is recording a Spanish version meant for people to facilitate an entire group in Spanish. Jody would like both. Perfect. If you have ideas about another language, another group that you would like to do this for, we do not have the skill set here to do any more languages in the video, but if somebody would like to, Rosa, you don't speak Portuguese, do you? I didn't think so. Or Haitian Creole, or, if you have other, we can work with you. So like, let us know if there is, and we can, hopefully you have access to someone who's a leader in that community who, you could give the video to and say like, could you do this in? But we will, while we don't have the skills to actually do it for you, we will pay for those things. So if you do need to have it translated or interpreted and have somebody record a Haitian Creole or a Portuguese or a Hmong version of this, let us know that that's going to happen. And we do have some extra funds for making some of those things happen. Anybody else? We're going to let you go early then. How exciting. 20 whole minutes. All right. If you have any other questions, you know where to find us. We will send you this information right away. We may also ask you if you are willing to facilitate in another group. If another group, that we have had a couple of groups that have said we would like to host, but we don't have enough staff to do the facilitation because we can't pull them away from the other things that they're doing. So we may throw that out as an extra, like, anybody want to pick up a couple of extra facilitations, we would love that. Otherwise, I think you're free to go. Thank you all very much.
Thanks, guys.
Have a great rest of your day.
You too.
Bye, thank you.